My name is Phoebe Sewell, and my topic was instrument choice and risk for noise-induced hearing loss for college music majors.
And I'm Sarah Andersen. My study is entitled College Music Majors and Non-Music Majors, Hearing Thresholds and Distortion Product Otoacoustic Emission Results.
First, I'd like to define noise-induced hearing loss, NIHL. If you look at the audiogram on the right, this is a depiction of normal noise-induced hearing loss with a noise notch at 3,000 Hertz. The American Hearing Foundation defines noise-induced hearing loss as permanent sensorineural hearing loss between the range of 3,000 to 6,000 Hertz. This is caused by continuous or intermittent exposure to high levels of noise. What will define risk for noise-induced hearing loss? We can look at NIOSH and OSHA for the definition of this. OSHA is the Occupational Safety and Health Administration, overseen by the Department of Labor. They are used in more of an occupational setting, such as an industrial. NIOSH is the National Institute for Occupational Safety and Health. They are overseen by the Centers of Disease Control and Prevention. They believe that noise-induced hearing loss occurs at lower levels than previously believed and recommend using a more stringent criteria. If you look to the table on the right, this is how we define noise-induced hearing loss. The PEL is the permissible exposure limit. This is the legal limit of time that an individual can be exposed to loud sounds over a certain amount of time. The time-weighted average is that certain amount of time. The exchange rate can be thought of as a doubling rule. If you add 3 or 5 to the PEL, that time-weighted average is then cut in half. An additional 3 or 5 added will then cut that time exposure in half again.
So just another quick definition that I want to touch on that I'll cover in a couple of slides and then further in my study are DPOAEs. Otoacoustic emissions are low-level sounds emitted by the cochlea due to the motion of the outer hair cells, and either from spontaneously or in response to an auditory signal. Distortion product otoacoustic emissions, which I'm doing in my study, is when we simultaneously play 2 tones into the ear canal, the first frequency being a lower frequency at 65 dB SPL, and then the second tone is a slightly higher frequency in relation to the first, and that's played at 50 dB SPL. The distortion product, what we're measuring, occurs at 2 times the first frequency minus the second frequency. And we consider the emission to be present if it is 6 dB or louder above the noise floor. So there's been a lot of research done in professional musicians and noise-induced hearing loss. McBride et al. Found that in professional musicians that there is more of an occupational risk for noise-induced hearing loss because they were measuring sound levels that exceeded OSHA's criteria of 90 dB. Schmidt and colleagues found that they were, with higher exposure times, so longer periods of noise that these people are being exposed to, there's a greater threshold shift than those who are not being exposed to noise for as long a period of time. So this research demonstrates that professional musicians with more experience will have longer exposure times and increased playing hours. Therefore, the amount of experience a professional musician has and hearing loss may be correlated. Also, that professional musicians are exposed to dangerous levels of noise and were more at risk for noise-induced hearing loss than individuals who are not exposed to high levels of noise on a regular basis. Noise-induced hearing loss in student musicians has also been studied. In 2009, Walter was measuring a wind ensemble in a university and found that half of the students in this ensemble exceeded the NIOSH standards of 85 dB for at least one rehearsal. Most recently, Henning and Bobholz analyzed the differences in the thresholds and DPOAEs in music majors and non-music majors. They found that while there was no difference in thresholds, there were more absent DPOAEs in music majors than the non-music majors. However, a limitation to this study was that there was 33 women in the control group and only 2 men, whereas the music majors were a little bit more evenly matched with 18 women and 10 men.
Then when examining instrument type for noise-induced hearing loss risk, McBride's study on professional musicians found that 2 risk groups emerged. A high-risk group that exceeded the 90 dB criterion for OSHA were the woodwind and the brass instruments. They found that the string instruments did not exceed this 90 dB criterion and found that they were at a lower risk. Walter's study that examined student musicians found that the brass instrumentalists were at a higher risk for noise-induced hearing loss than woodwinds and strings. So this brings us to my capstone. We determined that both students and professional musicians are at risk for noise-induced hearing loss, but there's still a question on the link between certain instruments and the exposure level to which students are exposed to. So my research was conducted to better understand the relationship between the noise levels per instrument choice of a college music major. My methods and procedures. I used a level 1 Quest Electronics Model 1800 sound level meter. The sound level meter was calibrated to the manufacturer's specifications and met the American National Standards Institute specifications. If you look to the right, you can see the parameters required for NIOSH comparisons. And the table on the left is the parameters I used in my study. A weighting is used because this is the frequency response that best resembles that of a human ear. The time constant of slow was used because this allows the sound level meter to respond to fluctuations occurring within 1 second. The range measured was 60 to 120 decibels. This allows the sound level meter not to overload and also incorporates the upper limit of 115 dB for the NIOSH criterion. The mode that the sound level meter was set to record in was LEQ. This is the equivalent continuous exposure level over a period of time. Recording in LEQ also allowed for the maximum decibel measurement to be saved, as well as how long the sound level meter was set to record. The second part of my materials was a questionnaire. There were 2 parts of my study and 2 parts of my questionnaire. The first part focused on the ensembles and the courses, and the first question I asked in my questionnaire was, what instruments do you play for your classes on campus, asking the students to indicate their primary instrument first. This primary instrument then allowed me to sort the participants into 4 categories of either woodwind, string, brass, or percussion. The second question asked how many hours are practiced in and outside of class weekly. The last portion of part 1 was to record the ensemble sound level measurements. For part 2 of the questionnaire, the participant just opted in to being contacted at a later date for individual sound level measurements, and then we scheduled an appointment to record those on campus. I surveyed 166 UWSP college music majors. 102 music majors data was reviewed after removing duplicate participants, other majors, or music minors. Anyone who was not between the age range of 18 and 24 was also excluded. Many participants opted into part 2 and then failed to respond to my contact, or actually just didn't show up for the appointment. So I did change my IRB protocol to allow recruitment from the practice rooms. After changing my IRB protocol, I obtained 7 participants for part 2. For the sound level meter placement, I used OSHA guidelines because I used a free field microphone that's a handheld on a tripod. And OSHA has more guidelines on how to use a sound level meter like this, whereas NIOSH uses more of a dosimeter, which is clipped to an individual. OSHA defines hearing zone as within 2 feet of the individual's head. But they do say that practicality and environmental factors need to dictate your placement. Using a free field microphone, you must use a 0-degree angle pointed directly at the source. For these reasons, I used 0-degree angle measured 1 meter from the source. 1 meter was used rather than 2 feet. That way I was incorporating all of the instruments in the ensemble rather than a particular instrument or section. The sound level meter was also moved in 3 equal time measurements for part 1. So if an ensemble practiced for an hour, I would record in 20 minutes left, center, and right. For part 2, I used the 0-degree angle with 1 meter as well for just consistency and to allow comparisons to part 1. Since there was only 1 source, the sound level meter was not moved. For the ensembles, the sound level meter recorded for 40 minutes to 2 hours. If the ensemble broke into individual sections, the sound level meter was paused until they came back together or stopped if they did not come back together. For part 2, for the individual practices, I recorded for 30 minutes to 1 hour. Breaks were taken and the sound level meter ran during those breaks to incorporate what the actual LEQ would be for a practice session for that person. Breaks included a lot of text messaging, leaving the room, and changing music sheets. Now for my results. I sorted each participant into their main category and averaged the hours that they reported. The instruments can be seen on the x-axis and hours are on the y-axis. The blue bars indicate the weekly hours practiced in class, and the orange bars represent the hours practiced outside of class. No trends were seen per instrument choice, and the hours practiced was highly variable among the participants. This variability will put some individuals at a higher risk for noise-induced hearing loss than others. Then I sorted the participants into instrumental categories. Again, the blue bars are for hours in class, the orange bars are for hours outside of class. All categories practiced equally with the exception of the strings in class. This difference was not significantly different, but can be seen visually. The last part of portion one, or part one, was to record sound level meters measurements on a separate day for the entire ensemble. dBA is on the y-axis for the maximum, which is the blue bars, the LEQ, which is the orange bars, and then hours is on the y-axis for time, which are indicated by the gray bars, which are kind of difficult to see since they're so small. There is the number next to the orange bar there. The 8-hour NIOSH PEL is graphed with the yellow line across the top. Any LEQ exceeding that yellow line would indicate the possibility of exceeding the NIOSH standards for an 8-hour day. The ensembles did not practice for 8 hours a day, but the wind ensemble and campus band participants could exceed those standards when combined with their other ensembles and their individual practices. Pep band, however, would exceed a NIOSH PEL of 92.5 after 1.5 hours. Although I only recorded their practice session for 0.6 hours, Pep band plays at football games and off-campus events, and they do play for over an hour and a half when they're doing that. So any time that they're on an off-campus event playing, they are exceeding the standards. For part two, for the individual practice session, hours is on the y-axis, but this time hours practiced inside of class are the light green bars, and hours outside of class are the dark green bars. The maximum is in dBA on the y-axis is represented by the blue bars, and the LEQ by the orange bars. I've bolded the LEQ numbers just because that's what we're really looking at here when we're comparing to NIOSH standards. So again, we have the yellow line indicating the 8-hour NIOSH standards. But many of the participants said when they went into a practice room that they would practice for a minimum of 1 hour. So we have the PEL of 94 for 1 hour, indicated by the red line. The trombone and the trumpet instrumentalists are at risk for noise-induced hearing loss if they practice for 2 hours or more. This is very likely considering that they practice on campus and have other courses and ensembles that they're playing in. The alto and soprano saxophone, he was the same instrumentalist, but we recorded him in 2 different sessions, and he is at a very high risk for noise-induced hearing loss because he exceeded the 1 hour PEL. This participant is also at a higher risk because he has the highest outside reported hours out of all of my participants. One thing that I would like to note about this person is that their maximums were the highest I recorded, but this is likely due to him doing mouthpiece exercises that were extremely loud. And he said he did this every time before he played, so I did incorporate them into my data. So putting this all together, using a NIOSH criterion to define risk for noise-induced hearing loss, students in pep band, wind ensemble, and campus band are all exposed to high levels of noise and put at risk for noise-induced hearing loss. Pep band does not require being a music major to participate in the course, but the only participants I surveyed in this course were music majors. When examining instrument type and the category they were put in, it was found that saxophone, trumpet, and trombone are all at a higher risk for noise-induced hearing loss. These are woodwind and brass instruments, which is similar to previous studies that have found that strings are not at as high of a risk for noise-induced hearing loss. The one thing that I would like to note is that in all of the ensembles, other than the woodwind ensemble, there were string instruments in the room with them. So these string instrumentalists are still exposed to these high levels from woodwind and brass instruments, putting them at risk. Some limitations and future directions of my study are that I had a limited participants for part 2. Ideally, I would have had participants from part 2 that represented every instrument that I found in part 1 and multiple, so I could run statistical analysis. Another limitation was my recruitment method. I should have initially recruited from the practice rooms rather than trying to chase people down, and I think I would have been able to obtain more instruments this way. Future directions could be asking how many hours are practiced every day of the week and which courses they are in for the semester. This would allow to look at PELs daily for the person and really examine that individual's risk further. Also, if someone was in pep band, wind ensemble, and campus band, they are obviously going to be at a higher risk than someone just in wind ensemble. Future directions could also be using a dosimeter or multiple sound level meters.
So that brings us to my portion. Purpose of my study was to look at the music majors and non-music majors and to the hearing thresholds and DPOAEs and see if we need to begin implementing a hearing conservation program within the music department here on our campus. My questions: will college age between 18 and 24 years old music majors display lower amplitudes and or absent frequencies in DPOAE results? And will music majors have poorer hearing thresholds, especially from 2,000 to 6,000 hertz as compared to their non-music major peers? I was focused on 2,000 to 6,000 hertz because that's where that noise notch lies in noise-induced hearing loss. Methods and procedures: I had recruited 31 students, 13 non-music major women, 9 non-music major men, 2 music major women, and 7 music major men. I ended up with 28 students with both ears and 1 student with 1 usable ear. Materials and equipment: I used the Welch Allen otoscope, the Grayson Stadler GSI TempStar Pro tympanometer, the Biologic Scout Sport PC-based diagnostic otoacoustic emission system, the GSI AudioStar Pro clinical audiometer, and a questionnaire of my own design. We began with informed consent and the questionnaire. The questionnaire asked about outside noise exposure, which I'll talk about a little bit more in the results. I then performed otoscopy. I was looking for any perforations in the eardrum or another outer ear abnormality which may exclude them from my study. And cerumen was removed if it was necessary. Tympanometry norms were used as listed here, and if participants did not fall within these norms, they were excluded from the data analysis. I needed to make sure that they had healthy middle ear function in order to be included. DPOAEs were next. I ran a diagnostic test from 750 hertz to 8,000 hertz, and again, like I said before, the emission is considered present if it is greater than or equal to 6 decibels above the noise floor at each frequency. Pure tone air conduction audiometry was next with insert earphones at 250 to 8,000 hertz, and I used the modified Houston-Westlake procedure, which is our 10 down, 5 up procedure as according to the guidelines of the American Speech, Language, and Hearing Association. My results. So here's the first couple of questions on my questionnaire. I did ask about firearm use. You can see that more of the non-music majors than the music majors are reporting firearm use with regular and some hearing protection. And then that last line on the bottom, headphone use, not surprisingly, 100% of both groups are using headphones. And I'll talk about the length of time that they wear their headphones and volumes in a couple slides. Again, not surprisingly, 100% of those music majors are attending concerts, and 80% of non-music majors are attending concerts. I also asked about other high noise activities with hearing protection. You can see those numbers there. And lastly, I asked if you believe that you may have hearing loss. So 20%, 4 out of the 20 non-music majors reported that they believe they may have some hearing loss, but 67% of the music majors believe they may have some hearing loss, which also may explain why I made several pairs of musicians' molds this semester. So then they participated in my study. So here's the headphones, the length of time that they listen to at any given chunk of time instead of just over the day. And then if their volume is loud or soft enough, if they can hear conversation around them or not. So that first line, they're listening to their headphones anywhere between 1 to 2 hours, or 1 minute to 2 hours, but their volume is soft enough that they can hear conversation around them, which is good. So that was the majority of both groups. And then the third line down, I want to point out, these students, mainly the non-music majors, reported that they're listening to their headphones for a minimum of 30 minutes, up into 2 hours at any one given chunk of time, but they cannot hear conversation around them. So their volume is loud enough that they cannot hear anybody talking around them. So my DPOAE results, in my non-music majors, I found that 5 out of the 20 had at least 1 missing frequency. 2 women and 3 men, so there was not a gender difference in this. In the music majors, I had 1 woman who had at least 1 missing frequency, and her hearing thresholds were all normal. This is just a visual of what I just stated. The dark blue bars being the students who passed all frequencies, and the lighter blue bars being the students who failed at least one frequency. The statistical analysis that I ran was the chi-squared test. For the contingency table that I used, I just said passed all frequencies or failed at least one frequency. It came up with a p-value that was greater than 0.05, so that's not a significant difference. Roughly 8,000 hertz was the most common missing frequency, and I did not include any of the frequencies below 1,000 hertz because that runs into the noise floor, so it's not reliable. With such a small number of participants, this really isn't generalizable. Air conduction testing. I want to touch that normal hearing is considered 20 dB or better. So all participants, with the exception of one, had normal air conduction thresholds from 2,000 to 8,000 hertz. The exception was one male music major. He had a flat, mild hearing loss in both ears. It was not a notch, and all of his DPOEs were present. I ran another chi-squared test again, and not surprisingly, the p-value came up as greater than 0.05. And for the contingency table, I did hearing loss versus no hearing loss. So again, this is not a significant difference, but also it's not generalizable due to the small number of participants that I had. So in conclusion, the results that I found indicate that there is not a significant difference in between these two groups, but like I just stated, small number of participants, which was very unfortunate. Limitations and future directions. Hopefully we can get some more music major participation. It was not for lack of trying. It was very difficult to get them to be interested to walk over from the Noel Fine Arts Center, the long walk over to the CPS. There was a large difference in women participants. So I had more women participants than, especially in the control group, than I did in the music major group. And then in the questionnaire, I did not ask about previous 24 hours noise exposure, because I mean, if you went to a concert last night, you're going to have most likely a temporary threshold shift or a missing frequency in the DPOE test as a result. So next time, I would have asked about the previous noise exposure. Our references. And then thank you to our supervisor, Dr. Henning, and thank you to my committee, Dr. Fowler and Dr. Lee.
And thank you to my committee, Dr. Douglas and Dr. Kroll, and a special thanks to our family, friends, and for all the love and support.
And each other. Questions?
I have a question for Phoebe. That was really, both of yours are really interesting. The data you collected on the sound levels in the ensembles, are you going to share that with the School of Music? Are you going to incorporate it in some way?
So I actually did share it a lot with the School of Music. We went to maybe 3 of their faculty meetings and just kind of discussed this with them, and then are sending them this presentation afterwards for them to share with students. We did offer to do a colloquium to the students, and at this time they didn't have time to fit it into the semester, but it is something that they're interested for next year. And then I will add too, they did have OSHA come out and evaluate the rooms, and they found that they had to make modifications, made those modifications, and do meet OSHA standards.
I didn't say anything about percussion ensembles. Did you get a chance to record any of their stuff?
I did not. The percussion were just impossible to get a hold of. They were few and far between, and a lot of those instruments they're large and they have to pull out from other rooms, and so they just really didn't respond and were hard to find, which would have fallen probably into a higher risk group because they were very loud.
Okay, my question is for Sarah. I thought it was really interesting when you said that 67% of people thought that they had hearing loss and 20% of people thought they had hearing loss. Mm-hmm. So do you have any ideas in what situations they reported that in, or do you have any ideas in why they thought that even though they had no thresholds?
Okay, so a lot of the talk in the music department is when they built the Noel Fine Arts Center is that the acoustics are just terrible. It just makes everything so much louder. So I feel the music majors were kind of talking to me about how they feel that they are in so much noise, and sometimes their ears are ringing after rehearsals, and so that they thought that they probably do have some hearing loss as a result of this. They did not give any specific situations that they were struggling hearing. I mean, maybe background noise, but typical.
Hi, great job, both of you. So we've done a lot looking at these college music majors, and I'm just curious what you two might think to say to younger musicians, like high schoolers, even middle schoolers, about protecting their hearing.
Well, I've been pushing my brother to wear hearing protection when he plays his drum set, to no avail. He's a freshman in high school. But go ahead.
So NIOSH actually has a great article. It's a PDF that's supposed to be visual, and it's how to implement noise hearing protection starting at 3rd grade up until high school. And they find that when you do these programs, that those students are more likely to then protect their hearing. One thing I will say for us is we were able to get a lot of musicians in the study and to participate through offering them noise protection at cost. So because they were students, they could get it at cost. We encourage them to get this now and learn to practice with it, because you do have to kind of retrain your brain a little bit when you're wearing that protection to make sure that those notes are sounding the same as without.
Just a note, your brother does always wear hearing protection.
Great. Excellent. Good to hear. Any other questions?
All right. Thank you, guys.
Thank you so much.